Hi, I'm Anna. I'm a birth and postpartum doula in our community and a women's health innovator, and I'm training to become board certified as a lactation consultant. Here in Kitchener-Waterloo, I help people connect to resources that they might need during their pregnancies and postpartum, specifically after a fertility journey. So today I want to talk to you a little bit about prenatal anxiety after doing IVF, when you're in that stage where you're pregnant after so much work, and it's hard to turn off your brain that's going so rapidly still. So I want to connect you to a few supports in our community in Kitchener-Waterloo, Cambridge, and Guelph that might be specifically helpful for you if this is something that you would identify with. Also, this is my dog, if you can see him. His name's Alfie.
Hey, buddy. Want to say hi?
Let's first start with just getting on the same page that prenatal anxiety is not a lack of gratitude. It's not that something's wrong with you. It's a very natural nervous system response to being hypervigilant after having gotten your ducks in a row in such a specific way in order to get pregnant. It feels like the ball could drop at any moment for a lot of us. I'm making this video to help normalize your experience and connect you to resources in our Kitchener-Waterloo community that might be able to help you feel better during your pregnancy. Because all of us know that when people say to just relax, it's not exactly that simple. Let's talk about some very normal fears and anxieties that come up when you're pregnant after IVF. The first one is fearing viability when you're not doing constant monitoring ultrasounds anymore. This is so normal because constant monitoring was such a big part of your journey. Many of us feel this way. We have trouble trusting our body to take care of this pregnancy on its own without more intervention. It's really normal because throughout this entire infertility treatment process, we've been going in to get ultrasounds and blood work done. And suddenly, when those appointments end and we're told things are going well, it's hard to believe that that could possibly be true because the way we got here was through that constant monitoring, constantly being reassured by a medical professional like a nurse on a daily basis that things were going well. And now we find that our anxiety spikes in between appointments during our pregnancy because it's hard to trust that our body is doing the right things, even if things are going really well and your numbers always look good and you're right on track. We find that in between appointments, that anxiety can really grow, especially if you're pregnant after doing IVF or other fertility treatment. Another thing we often feel that's kin to anxiety is a sense of cautious optimism, but not a full excitement, or a lack of joy with our pregnancies. Especially if you have a history of pregnancy loss, it can feel like we're waiting for the ball to drop and we don't want to get too attached. And that can contribute to our anxiety throughout pregnancy as well. I just really want to emphasize that all of these things I'm describing are not negativity. They're not a character flaw. They're ways our nervous system, our brains, and our bodies work together to protect ourselves. It's a sense of being guarded against the things that have hurt us in the past. You can think of it as emotional protection. And you don't necessarily need to stop doing any of these things, but the experience of feeling this way is not great. And so I want to help you find some resources that can help you feel better and feel good about your pregnancy throughout the time that you're pregnant and you're not doing the monitoring appointments. The first thing I want to talk about is using an at-home Doppler. Now, if you don't know what a Doppler is, it's a device that lets you listen to your baby's heartbeat and measure the heart rate at home. There's medical grade Dopplers, and there's also a lot that are available that are more intended for consumers like parents to purchase. And there's a really varying degree of accuracy and quality between all of these devices that are available. They've become more common for people to buy for themselves. I'd really encourage you to talk with your medical practitioner about it if you're going to be buying a Doppler. Now, when we're using Dopplers in a pregnancy after fertility treatments or pregnancy after loss, there's some nuance to knowing when it's helpful and when it's not. Sometimes it can be a really good tool for peace of mind. When we're panicking and feeling like we haven't felt enough movement, it can really help settle us to hear our baby's heartbeat. Now, on the flip side of that, sometimes it's easy to go too far. If you already have some anxiety brewing, it can feed that anxiety when you're not able to check the baby's heart rate all the time. If you find that you're constantly checking, it can be similar to how We were used to the constant checking in your fertility clinic, and then all of a sudden, in between appointments, you're finding that your anxiety is spiking. We can have the same thing happen with using a fetal Doppler at home. When we're not checking, we're constantly wondering if baby's okay. In that case, it might be more helpful to work with your medical provider or maybe a therapist or a counselor to develop a plan to help you manage the anxiety about your baby's well being and develop a little bit more trust in your body. In that case, I'd recommend that you reach out specifically to a perinatal therapist. There are many in our community who are amazing, and a quick Google search will point you in their direction. It's really important that you work with somebody who has an experience supporting people through pregnancy and especially through pregnancy after loss or fertility treatments because this is such a common experience, but it's something that's very nuanced and hard to understand if you haven't gone through it yourself. This is especially important if you've experienced panic, intrusive thoughts, or previous depression and anxiety. Now let's talk about some body-based supports. We've talked about the mental side of things, that you want to find a really good perinatal therapist. What you also want to find is a couple of people who can take care of the physical side of anxiety and stress. And one of my favorite ways to target this is through acupuncture. And before you stop the video, hear me out. I've always been somebody who is very tied to evidence, and acupuncture was really new to me. There is a lot of research behind acupuncture's positive effect on stress and anxiety, as well as fertility outcomes. So before you throw it all away and think that it's too woo-woo, I would definitely recommend giving acupuncture a consideration, if not a try, because we do see several studies that show it's very beneficial to helping our bodies regulate stress levels. The way acupuncture can contribute to this is through helping regulate our nervous system. Now, I have to recommend that you find an acupuncturist who is familiar with the safety protocols that would be necessary throughout pregnancy and can make sure that you're doing this safely. Another really important component to making sure that our bodies are able to release the stress we're feeling from this elevated anxiety is through massage therapy and pelvic floor physiotherapy. These two modalities I would recommend no matter what if you're pregnant because they're so helpful to helping your body adjust as it changes so much throughout pregnancy. But they're also really helpful for targeting those physical spaces that stress is living in your body. Massage therapy is great for that head to toe relaxation and maybe a little bit of working on your aches and pains that you might be experiencing, especially as your pregnancy progresses. And pelvic floor physiotherapy is amazing because we hold a lot of stress and tension in our pelvic floors. And when we're pregnant, our pelvic floors are going through a lot more stress than normal. And so it's really helpful to do both pelvic floor physiotherapy and massage therapy. We do really hold a lot of stress and anxiety in our bodies. So it's not just for the physical promoting a more physiological birth, if that's what you'd like, or promoting better recovery postpartum. It really is also about helping us regulate our nervous systems. A doula's role isn't just attending your labor. A big part of my role as a doula is providing a consistent, trusted companion that can help you regulate your nervous system throughout your pregnancy and into the delivery room. A doula can be a really helpful resource when you're navigating anxious thoughts that don't necessarily need to be escalated to your therapist. It's really just needing to hear from a friend, somebody who knows pregnancy and birth, that yes, this is normal. A reminder you're doing a good job, a reminder to trust your body. Obviously, we're not stepping into the medical realm here. We're talking about those anxious thoughts that you're aware are not signaling that there's anything wrong. It's just your anxious thoughts that are there because you don't have the constant monitoring you're used to. But ultimately, you and your baby are safe. So that's where doulas can be really helpful when it comes to anxiety. It can also be really helpful to have a doula because we can help you translate that medical knowledge from your appointments. Anything that comes up throughout your pregnancy that makes you feel a little bit more anxious, you can talk to your doula about, and then you can sort out how you feel, what more information you might want to ask for, and ultimately settle on decisions that you feel really confident about. Having a practitioner who's familiar with your story, who knows what kind of tone and experience you're looking for throughout your pregnancy and into your labor, and somebody who is ultimately a trusted friend can really decrease your anxiety throughout your pregnancy. Another part that's really crucial about doula care is that we're available between your appointments when your healthcare practitioners aren't, if you just need a little bit of reassurance. If your anxiety is beyond the point of being just a little bit extra nervousness and it's interfering with your work or the rest of your life, your ability to care for yourself or your relationships, that's when it's really crucial that you reach out for more mental health support, whether that's from a perinatal therapist, talking to your family doctor, or another medical practitioner. Sometimes medication, therapy, or other life supports can make all the difference in helping you enjoy your pregnancy rather than endure it. Your emotional safety during your pregnancy has immeasurable effects on your birth experience and your postpartum experience. So it's really important not to minimize anxiety you're feeling now, and instead figure out what care and supports you might need to feel a little bit better. When we support your anxiety throughout your pregnancy, we notice that your mood postpartum is a lot more positive. Your birth experience is more positive. You feel supported and you feel confident in your ability to cope. And this makes all the difference. It also helps with clearer decision making when you're feeling like you're mentally strong and you trust yourself on your decisions. And it can also help make bonding with your baby easier when we decrease those anxiety levels to a baseline. Now, as a doula, I work with parents who have navigated IVF or infertility or are pregnant after loss. And I work with you to help figure out what resources in our community you might need, in addition to doula care, to help manage any anxiety you might be feeling throughout your pregnancy. But the point I really want to bring home is that almost everyone feels this way. If you've gone through years of regular appointments, getting checked up on constantly, almost daily, it's a really big shift to go from everything being so minutely controlled to all of a sudden you don't see your doctor for a long time in between appointments. And that gives a lot of space for our thoughts to get a bit out of control. I really want you to know that these thoughts are so normal and they also don't have to be driving your anxiety. We can figure out ways to help you cope throughout your pregnancy and feel a lot better. Ultimately, caring for yourself and your anxiety throughout pregnancy is going to make everything else a lot smoother in your journey to bringing this little one into the world. So, if you'd like to work together or even just chat a little bit about what this might look like for you, you can go to my website. It's sagebirthbyanna.com. I serve the Kitchener-Waterloo, Cambridge, and Guelph region, and I would love to chat and possibly work with you.